Okay, so we're going to be in Chapter 10, the ophthalmic agents, starting on page 134. Okay, so on 134, that box 10(1), that lists the categories of agents used in ophthalmic surgery. Ophthalmic agents often occur or often appear on the sterile back table, so that's why you need to know all this. It's critical for surg techs to properly identify and label all medications received into the sterile field, especially when the operative microscope is used, because the surgeon must keep focused on the operative field and can't keep looking away to verify your agents. So there has to be a sense of trust here. Okay, so on page 135, that figure 10.1, that shows the anatomy of the eye. The eye is a complex sensory organ, and again, this piggybacks onto what we learned in your other textbook. But it receives visual stimuli and sends signals to the brain for interpretation. So on 134 under the anatomy review, second sentence, each eyeball is controlled by cranial nerves 3, 4, and 6. I'm sorry. Yes, and attached to 6 extraocular muscles for movement. These are the medial, lateral, superior, and inferior rectus muscles and the inferior and superior oblique muscles. Okay, at the top of the second column, a thin transparent mucous membrane called the conjunctiva lines the inside of the eyelids and the anterior surface of the eyeball or globe. Further down, the fibrous outer coat of the eye is composed of a dense white connective tissue called sclera. Sclera gives the globe its shape, provides protection, and can be seen through the conjunctiva as the white of the eye. The anterior covering of the eye is made of clear, non-vascular fibrous tissue called the cornea. The cornea does not contain blood vessels to provide its nourishment. Rather, it is nourished by being bathed in a solution called aqueous humor and from oxygen in the air. It serves as the window of the eye. The area where the cornea and sclera meet is called the limbus. Deep to the limbus is a venous sinus called the Schlemm canal. And again, you can see all of this on 135. Again, on that diagram on 135, I have circled the iris, and then it separates A and P chambers, the anterior posterior chambers, the iris. All right, moving on. The vascular layer of the eye is called the choroid. The anterior and thickest portion of the choroid is the ciliary body. The ciliary body secretes aqueous humor from structures called ciliary processes. Yeah. Ciliary muscle arises in the ciliary body and attaches to the lens, altering its shape to accommodate near or distant vision. Okay. The iris is attached to the ciliary process and is positioned between the cornea and the lens. The pigmented iris consists of radial and circular muscle fibers whose function is to change the size of its opening, called the pupil. The pupil regulates the amount of light entering the eye by constricting, which means to making an opening smaller, or dilating, which making an opening larger. The nervous layer of the eye, called the retina, is present only posteriorly and covers the choroid. Okay, all right. The first column on the next page at the bottom of that first little part before the make it simple, the lens, which is normally transparent, is covered by a clear fibrous capsule and held in place by suspensory ligaments called zonula. Then keep on going. The interior portion of the globe contains 2 cavities, anterior and posterior, separated by the lens. The anterior cavity, the anterior chamber, a little further down, is posterior to the cornea and anterior to the iris. The posterior chamber is behind the iris and anterior to the lens. The entire anterior cavity is filled with aqueous humor, or fluid, secreted by the ciliary processes. Aqueous humor flows forward in the anterior cavity and drains through the trabecular meshwork into the Schlemm canal. If a blockage occurs in the trabecular meshwork, intraocular pressure or IOP builds, causing glaucoma. Glaucoma is the term used to describe a group of ocular conditions characterized by increased IOP. The posterior cavity, which is between the lens and the retina, is filled with a thick substance called vitreous humor. Vitreous humor gives the globe its shape, keeps the retina in position, and contributes to IOP. Unlike aqueous humor, vitreous humor is not naturally replaced by the body. Okay, so above where it says in blue, glaucoma, there are the words trabecular meshwork. I have drawn a line down under this column and put chronic open angle glaucoma is blockage of trabecular meshwork. So chronic open angle glaucoma is blockage of trabecular meshwork, of the trabecular meshwork. Okay, so that is the issue with the trabecular meshwork. If there is blockage, that is the chronic open angle glaucoma. Okay, let's keep on going. Actually, before we keep going on that, I think, yes. So the eyebrows, eyelids, and eyelashes have structural functions serving the eye. The lacrimal system produces, distributes, and removes tears, which keep eye surfaces moist and clean. Okay, so a lot of these slides that we're about to come on, we've just talked about. The conjunctiva lines the inside of the eyeballs and the globe. Conjunctivitis is a relatively common eye disorder. Like the conjunctiva, the bony orbit serves to protect the eye with support of fat and fascia, and the globe of the eye has 3 layers of tissues. The outer layer, or sclera, is the first part of the fibrous layer. It gives the globe of the eye its shape. The sclera is commonly known as the white of the eye, which we talked about. The limbus is the area where the cornea and sclera meet. Deep below the limbus is a venous sinus called the canal of Schlemm. The second part of the fibrous layer of the eye is the cornea. Whereas the sclera is the white of the eye, the cornea is the window. The cornea contains no blood vessels, instead getting nourishment and oxygen by being bathed in a solution called the aqueous humor and getting oxygen from the air. The second tissue layer in the eye's globe is vascular. The vascular layer of the eye is called choroid. The anterior and thickest part of the choroid is the ciliary body. The ciliary body secretes aqueous humor from ciliary processes. The ciliary muscle attaches to the eye lens, helping to accommodate near and far vision. The iris of the eye, which is between the cornea and the lens, is attached to the ciliary process. In short, the iris works to change the size of its opening, which is known as the pupil. The pupil controls how much light enters the eye by constricting or dilating. The nervous inner layer of the eye, called the retina, is present only posteriorly. It covers only the choroid. The retina has sensory receptors called rods and cones that respond to images and send signals to the brain for recognition. The lens, another part of the eye, is just behind the iris. It focuses images on the retina. Normally transparent, the lens is covered by a clear fibrous capsule and is held in place by suspensory ligaments called zonula. The interior portion of the globe has 2 cavities, anterior and posterior. These cavities are separated by the lens. The anterior cavity is further divided into anterior and posterior chambers. The anterior cavity contains the aqueous humor, which is secreted by the ciliary processes. The aqueous humor drains forward through the trabecular meshwork and into the canal of Schlemm. A blockage in this meshwork causes intraocular pressure to build, leading to glaucoma. The posterior cavity, which is between the lens and the retina, contains a thick substance called the vitreous humor. The vitreous humor has a number of jobs, including giving the globe its shape, keeping the retina in place, and contributing to intraocular pressure. And so again, aqueous humor can be replaced by the body, but the vitreous humor cannot be replaced. The anterior cavity is divided into two chambers, anterior and posterior. Both chambers are filled with aqueous humor. The anterior chamber is posterior to the cornea and anterior to the iris. The posterior chamber, in contrast, is posterior to the iris and anterior to the lens. Glaucoma is the term used to describe a group of ocular conditions characterized by increased IOP. Okay, so on 135 at the bottom left, it says the blood-eye barrier prevents effective absorption of most systemically administered medications. For this reason, the most common administration route for ophthalmic medications is topical application, as drops, suspensions, ointments, and on medicated discs or pledgets inserted onto the eye. Ophthalmic agents administered topically enter systemic circulation through the conjunctival vessels and the nasolacrimal system. Approximately 80% of eye drops enter the nasolacrimal system, then drain from nose to mouth and enter the stomach where absorption takes place. Then further down, after administration of the medications, compression of the lacrimal sac prevents rapid drainage of medication into the lacrimal system where it is carried away from the eye. And you can see this on page 136 in figure 10.2 that illustrates the proper administration of topical ophthalmic solutions and ointments. So medication-soaked pledgets can be placed in the conjunctival cul-de-sac after the eye has been anesthetized with local anesthetic drops. Nanoparticles are an area of intense scientific and medical research. Okay, in that next paragraph on 135, the last sentence of that second to last paragraph, it says, Duracite extends the length of time the antibiotic is in contact with the ocular surface. This method is used in the treatment of blepharitis. Okay. Okay, so this will take us to page 136, the categories of ophthalmic agents. So the first one is the ophthalmic prep solution. So second sentence, betadine ophthalmic 5% prep solution is a sterile dark brown liquid stabilized by glycerin that contains 5% povidone iodine. It is used to prep the ocular region that also includes the eyelids, brows, and cheeks. So delicate tissues of the eye require special prep solutions. So the betadine ophthalmic 5% should be left in contact with the prepped areas for 2 minutes. Again, the betadine ophthalmic is a sterile dark brown liquid stabilized by glycerin. All right, next is irrigating solutions and lubricants. So the second sentence, the most common ophthalmic irrigating solution is balanced salt solution, or BSS. BSS is a sterile, physiologically balanced irrigant. And you can see this on page 137 in that figure 10.3. Okay. So when you're irrigating the solution, like the purpose of irrigation or the irrigating solutions is to cleanse the operative site and pretty much keep the cornea moist. The patient's not blinking anymore because they are either asleep or they're blocked, and so we have to continuously irrigate the eye because blinking is not available to that patient, and that's what blinking does. It moistens the eye. And a gauze sponge should never be used to wipe the eye. That's why we use the Wexels. Okay, so again, BSS is the most common irrigating solution. It's a sterile, physiologically balanced irrigant. And let's see, in blue, it says phacoemulsification is a type of cataract surgery. So just pointing that out again here, we're returning back. Phacoemulsification is a type of cataract surgery. Okay, so during most ophthalmic procedures, the surge tech will use BSS to periodically irrigate the cornea. Lubricants are used for patients undergoing surgical procedures other than ophthalmic surgery under general anesthesia to protect the cornea. Okay, so in that second paragraph above the caution, it says ophthalmic lubricants may be used when a general anesthetic is administered for any surgical procedure. With patients under general anesthesia, eyelids are relaxed and the corneal reflex is absent. To prevent corneal drying or damage and maintain integrity of the epithelial surface, a non-ionic ointment or lubricant such as lanolin alcohol or Lacrolube or polyvinyl alcohol, which is Liquifilm or Lubifresh, is applied to each eye. So this prevents corneal abrasions. Okay. All these lubricants, they're to prevent corneal abrasions. You need to write that down. So this is why you'll see anesthesia, they'll lift their eyelids and squirt this stuff from the tube and then either close their eyes or they'll tape their eyelids shut. So they are preventing corneal abrasions. Okay, the next category of ophthalmic medications is viscoelastic agents. These thick jelly-like agents are injected into the anterior chamber to help keep the chamber expanded during cataract extraction. They also replace vitreous humor or serve as a tamponade. Okay. Yeah. Examples of viscoelastic agents include sodium I can never pronounce this, hyaluronate, which is Amvisc plus Vitrax or Provisc, 2% hydroxypropyl methylcellulose or Occucoat, and a combination of sodium chondroitin sulfate 4% and sodium hyaluronate 3%, which is called Viscoat. So this slide provides a few examples of visco agents. The viscoelastic agents are supplied pre-measured in sterile measures with blunt-tipped cannulas, so you don't have to measure these out at all. Okay, further down in that paragraph it says, note that the term ophthalmic viscosurgical device or OVD is being used for viscoelastic agents because they are no longer considered as the only medications used to maintain space and coat ocular tissues. Rather, they are an integral part of cataract surgery and are being used in combinations as newer techniques for ophthalmic surgery are being developed. For example, the DuoVisc viscoelastic system combines two viscoelastic materials, Viscoat and Provisc, into a single system to be used during a cataract procedure. Another OVD available is 1.4% sodium hyaluronate, Morvisc or hyaluron. Okay, so again, viscoelastic agents are no longer considered just medications used to maintain space and coat ocular tissues. They are an integral part of cataract surgery and are being used with the newer techniques. All right, next is miotics. Miotics are medications that constrict the pupil by stimulating the sphincter muscle of the iris. Because constriction of the pupil, which is miosis, reduces IOP, miotics are frequently used in short-term treatment of glaucoma. All right, here are some examples of miotics. At the top of 137, a little further down, miotics may be administered by injection or topical application. Side effects include eye, eyebrow, or eyelid pain, blurred vision, abdominal cramps, and diarrhea. Acetylcholine chloride is a miotic agent available in a solution of mannitol marketed as Myocol E. Then further down, Myocol E should be reconstituted immediately before use. Carbachol, which is isotocarbachol, is used topically to reduce IOP and glaucoma, and by injection, which is Myostat, so that is not topical. I have a big box around that by injection, and I wrote out to the side, not topical. So Myostat is not topical, it's by injection. Into the anterior chamber as needed, intraoperatively. Pilocarpine hydrochloride, which is Pilocar isotocarpine in 1%, 2%, and 4% ophthalmic solution is another topical miotic. Further down, pilocarpine as acetylcholine. So I'm just showing you that pilocarpine, it can be used as acetylcholine. But pilocarpine at the bottom increases flow of aqueous humor through the trabecular meshwork. Thus, it is most useful in treating open angle glaucoma. So, and we wrote this on the previous page about the trabecular meshwork, chronic open-angle glaucoma. That's blockage. And so the pilocarpine is used to combat that. All right, miotics are also used intraoperatively when pupillary constriction is indicated, as in laser iridectomy. Occasionally, they're used to maintain the position of an implanted lens after cataract extraction. Again, acetylcholine chloride is a miotic agent that's available in a solution of mannitol known as Myocol E. The mannitol, with its diuretic effect, facilitates drainage of the aqueous humor. It must be reconstituted immediately before use. Okay, carbachol is a miotic used topically to reduce intraocular pressure in glaucoma and via injection into the anterior chamber intraoperatively. This is just going back over it. Pilocarpine acts directly on the smooth muscle of the iris to stimulate meiosis. Because pilocarpine increases the flow of aqueous humor through the trabecular meshwork, it is most useful in treating open-angle glaucoma. Okay, so let's go on to mydriatics and cycloplegics. So both mydriatics and cycloplegics are paralytic agents used to dilate the pupil before ophthalmoscopy. Both kinds of agents cause mydriasis, which is dilation of the pupil, by paralyzing the sphincter muscle of the iris. So again, both of these are paralytic agents used to dilate the pupil before ophthalmoscopy. Both cause mydriasis, which is pupil dilation, by paralyzing the sphincter muscle of the iris. Okay, cycloplegics also paralyze the accommodating mechanism, which means patients may be unable to see near objects clearly. So further down, it says common mydriatic agents are atropine sulfate and phenylephrine. Atropine sulfate, also known as atropazole, atropine ophthalmic, an anticholinergic agent, and a belladonna alkaloid is available for ophthalmic use in solutions of 0.25% and 2%, and an ointment of 0.5% and 1% for topical application. Okay, so here are some common examples of these agents. About 2/3 of the way down on that big paragraph, it says an example of phenylephrine, which is neosynephrine ophthalmic, or AK dilate, that is available in the solutions of 2.5% and 10% for topical ophthalmic use. Further down, cycloplegic agents include cyclopentolate, HCl, which is cyclogel, AK pentolate, and pentolair, available in 0.5% to 2% solutions, and tropicamide, yep, which is Midrasil, and Opticil, available in 0.5% and 1% solutions. Cycloplegic and mydriatic agents can cause side effects, including tachycardia, photophobia, dry mouth, edema, conjunctivitis, and dermatitis. But in surgery, agents like these are used to provide access to the eye. So the next category of ophthalmic agents is ophthalmic anti-infectives. Anti-infectives in ointment form are often used to treat external ocular infections. So at the bottom of that second column on 138, it says neomycin is also available as neosporin combined with polymyxin B sulfates and bacitracin zinc, commonly referred to as triple antibiotic ophthalmic ointment. Now you can get this OTC, but make sure that the kind that you're putting in your eye is not the same neosporin you're putting on your skin. Okay. So here's some common ophthalmic anti-infectives. In that paragraph at the top left on 139, it says other common ophthalmic anti-infectives include bacitracin ointment, which is actracin or basiguant, in 500 units per gram, or erythromycin, which is iloticin, 0.5% ointment, and sulfectamide, which is blef-10, and sulamide, in 10% and 30% solution and 10% ointment. So in surgery, anti-infectives are often used to guard against postoperative infection. Anesthetics are a unique category of ophthalmic agent because they interfere with normal transmission of pain impulses to the brain. So the fourth line under anesthetics, it says cocaine solution, 1 and 4%, was the initial topical anesthetic agent used in ophthalmology. However, it is currently used predominantly in otolaryngology. Two common topical ophthalmic anesthetics are tetracaine hydrochloride, which is known as Pontocaine, and proparacaine hydrochloride, which is Alkane, Opthane. And I have boxed Alkane because that is very common, the Alkane one. Most ophthalmic surgical procedures require a topical and injected anesthetic agent. Two common options, again, are tetracaine hydrochloride and proparacaine hydrochloride. Both are available in a 0.5% ophthalmic solution. Okay, the surgical applications of these agents are clear. They interfere with pain impulses, either topically or by injection. At the top of 139's second column, you need to know pretty much that whole paragraph except the few at the bottom. It says ophthalmic procedures requiring an extensive area of anesthesia are performed under a regional retrobulbar or peribulbar block. This type of anesthesia, which provides both sensory and motor or movement block, is performed with a local anesthetic such as lidocaine, and then I have a box around xylocaine 4% MPF, so that's the big one, the xylocaine 4%, or bupivacaine, which is 0.75%. But make sure if there's a question that says, is there such medication as xylocaine 4%? Yes, there is. In retrobulbar block, the agents are injected near the optic nerve. In peribulbar block, the injections are made in the soft tissue superior, which is above, and inferior, below, to the eyeball. Other agents may be added to the anesthetic, such as hyaluronidase, which is Vitrace. Hyaluronidase is an enzyme mixed with anesthetics to increase diffusion of the anesthetic through the tissue and to improve the effectiveness of the block. The final category of ophthalmic agents is anti-glaucoma agents. Glaucoma refers to the group of conditions characterized by increased intraocular pressure. Glaucoma can be caused by an overproduction of aqueous humor or by a blockage in the drainage mechanism, known as the trabecular meshwork. As their name suggests, anti-glaucoma agents work to effectively decrease that pressure. So halfway down that first paragraph, it says normal IOP is between 10 and 22 millimeters of mercury, and pressure greater than 25 millimeters of mercury is considered abnormal. This pressure damages the optic nerve and may cause blindness. After that note, it says the most common form of glaucoma is chronic open-angle glaucoma. In open-angle glaucoma, the trabecular meshwork cannot drain aqueous fluid effectively, which again we're touching on again. So there are several subcategories in this category of agents. So on 140, the first paragraph halfway down says, however, long-term management of increased IOP may be accomplished with several different types of agents, including prostaglandin analogs or PGAs, miotics, adrenergic blockers, alpha adrenergic agonists, and diuretics, particularly carbonic anhydrase inhibitors. Carbonic anhydrase is an enzyme present in the ciliary body. It catalyzes secretion of aqueous humor. A carbonic anhydrase inhibitor, such as acetylzolamide, which is Diamox, interferes with production of carbonic anhydrase. Thus, it reduces production of aqueous humor and decreases IOP. Okay, so osmotic diuretics are another class of anti-glaucoma agent. They may be used to treat glaucoma in the short term by raising the osmotic pressure of blood. And what that means is it's drawing fluid out of the eye, lowering intraocular pressure. So that next paragraph, it says, by raising the osmotic pressure of blood, osmotic diuretics cause fluid to be drawn out of the eye, lowering IOP. Further down, the most common osmotic diuretic used in ophthalmic surgery is mannitol, also known as osmotrol. Mannitol is a 5% to 20% solution, is given intravenously in a dose of quarter to 2 grams per kilogram of patient weight. Further down, when mannitol is administered preoperatively, an indwelling urinary catheter is usually inserted into the patient's bladder to accommodate resulting diuresis, which is the increased excretion of urine. All right, so the alpha adrenergic agonists are administered as eye drops. All right, so that little paragraph above the box 10.2, it says another category of medications used to treat glaucoma is the alpha adrenergic agonists, also called sympathomimetics, administered as eye drops. Yes, but you need to put a star next to that box 10.2, the categories of medications used to treat glaucoma. So this just lists out everything that we're talking about right now. All right, the next paragraph, it says a group of medications known as beta adrenergic blockers are also used to treat glaucoma. So the beta adrenergic blockers block beta adrenergic receptor sites. So these drugs, some of which are listed here on this slide, help treat glaucoma by reducing aqueous fluid production. Side effects of these agents include decreased heart rate and blood pressure. So halfway down that paragraph, it says timolol in 1/4% or 0.5% ophthalmic solution is administered in a dosage of 1 drop in the affected eye twice a day. So timolol is topical, and that's what I want you to take away from that you're dropping that into the eye. So if you see a test question that says, how do you administer timolol? It is topical, so TNT. So glaucoma can be managed in the long term with different kinds of diuretics, particularly carbonic anhydrase inhibitors. A carbonic anhydrase inhibitor interferes with carbonic anhydrase production, thereby reducing aqueous humor production and decreasing intraocular pressure. Agents like these are administered orally and intravenously, or intravenously. Side effects include lethargy, anorexia, drowsiness, nausea, vomiting, and hypokalemia. PGAs are now the first line of medical treatment for glaucoma. These agents significantly reduce IOP by increasing uveoscleral outflow, which is a different route than the trabecular meshwork. Only mannitol is administered during surgery. So there are two categories of anti-inflammatory agents that are used in ophthalmology, steroids and NSAIDs. The general purpose of anti-inflammatory agents is to reduce inflammation and swelling postoperatively. Okay, so under anti-inflammatory agents on 140, it says two categories of anti-inflammatory agents are used in ophthalmology, steroids and non-steroidal anti-inflammatory drugs or NSAIDs. Steroids are hormones with a wide range of effects. They are used in ophthalmology to decrease ocular inflammatory response to trauma, to decrease corneal inflammation, to protect the eye from scarring, and postoperatively to decrease swelling. So the first class of anti-inflammatory agents, so those are steroids, some of which are shown here, are hormones, again, with a wide range of effects. Um, Steroids are contraindicated in the presence of infection because they are not bactericidal and tend to hide the symptoms of an infection. So some common steroids at the bottom of that paragraph on 140, it says that they are betamethasone, which is Celestone Soluspan, that's a big one, dexamethasone, which is Maxidex suspension, Decadron ointment and solution, again another big one, and prednisolone, which is Inflamace or Pred Forte suspension and solution. You'll hear betamethasone and Decadron a lot, or dexamethasone a lot, especially in orthopedics, but also here in ophthalmology. So this slide provides examples of the second class of the anti-inflammatory agents, NSAIDs. So on 141 it says ocular NSAIDs are used to prevent or treat cystoid macular edema, iritis, and conjunctivitis. They are also used to reduce postoperative inflammation following cataract surgery. Ophthalmic solutions of ketorolac, 0.5%, which is Acular, diclofenac sodium, which is 0.1%, nepafenac, 0.1%, or Nevanac, and bromfenac, 0.09%, which is Zybrome or Bromday, are available. NSAIDs may also be used to inhibit intraoperative miosis, particularly flurbiprofen, 0.03%, which is Ocufen, and Superfen, 0.1%, Profenol. Side effects include eye redness, burning, and stinging when administered. Okay, so NSAIDs again are used to prevent or treat cystoid macular edema, iritis, and conjunctivitis. They're also used to prevent post-op inflammation following cataract surgery and possibly to inhibit intraoperative miosis. Okay, the final class of ophthalmic agents is diagnostic stains. Several agents are available for diagnostic uses. Most used in surgery are dyes, and dyes are used to color or mark tissue. So a couple lines down under diagnostic stains, it says diagnostic stains may also be used to observe the flow of aqueous humor or to demonstrate lacrimal system function. Examples are fluorescein sodium, rose bengal, and lissamine green. They are available as individually wrapped sterile paper strips, which are moistened with a sterile solution and applied to the anterior surface of the eye. So again, here are some examples of the ophthalmic dyes. Ophthalmic dyes are instilled topically to diagnose abnormalities of the cornea and conjunctival epithelium or to locate foreign bodies. Dyes may also be used to observe the flow of aqueous humor or to demonstrate lacrimal system function. Fluorescein sodium is a non-toxic water-soluble dye that is applied to the cornea or conjunctiva to identify denuded areas of epithelium or foreign bodies. It diagnoses corneal abrasions by staining damaged or diseased corneal tissue bright green. Rose bengal is an even better staining agent for devitalized cells. This agent is used primarily to demarcate the devitalized conjunctival epithelium seen in dry eye syndrome. So at the bottom of that big paragraph it says rose bengal and lissamine green in 1% solutions stain devitalized cells better than fluorescein sodium. These agents are primarily used for demarcation of devitalized conjunctival epithelium seen in dry eye syndrome, which is keratoconjunctivitis sicca or KCS. Lissamine green is a dye much like rose bengal. Indocyanine green is a diagnostic dye used for ophthalmic angiography. It's given intravenously outside surgery to visualize the choroidal vascular network. So basically, know the drugs you're handling and their categories and purposes. Especially in the ophthalmic realm, surg techs must know the agents they're handling to practice safely. And that wraps up Chapter 10, Ophthalmic Agents.